Heart disease is not just a health concern. It is a global epidemic that affects millions of people each year. Cardiovascular diseases claim approximately 17.9 million lives annually, accounting for an astounding 32% of all deaths worldwide. In the United States alone, heart disease has been the leading cause of death since 1950, with around 695,000 fatalities per year, equivalent to 1 in every 4 deaths. However, there is good news. Heart disease is largely preventable through lifestyle choices, diet, and exercise. One of the most renowned heart surgeons in history, Dr. Michael DeBakey, dedicated his life to fighting heart disease. He revolutionized cardiovascular medicine with groundbreaking innovations, including advancements in heart bypass surgery and artificial heart technology. Over his career, he performed more than 60,000 life-saving operations and mentored countless surgeons, leaving an indelible mark on modern medicine. His contributions extended far beyond the operating room, as he served as a medical advisor to every U.S. president since Harry Truman. Remarkably, Dr. DeBakey lived to the age of 99, remaining active in the medical field well into his 90s. At 90, he still drove to work, and at 97, he was still in the operating room. Dr. DeBakey's philosophy on health and longevity is well documented in his book, The Living Heart Diet, first published in 1984 and updated in 1996. His recommendations on nutrition and lifestyle continue to be relevant today. In this article, we will explore 5 key longevity tips from this legendary doctor, including the best foods to eat and avoid to maintain a healthy heart. If you find this article useful, consider subscribing to our channel and giving it a like to receive more valuable content on health, longevity, and disease prevention. 1. Stay active. Movement is key to heart health, Dr. DeBakey firmly believed that daily movement was crucial for heart health. He recommended walking for at least 30 minutes a day, incorporating both slow and fast walking to maximize cardiovascular benefits. Walking strengthens the heart, improves circulation, and helps regulate blood pressure. Throughout his life, Dr. DeBakey preferred to walk instead of using elevators and enjoyed gardening as a form of physical activity. Interestingly, he also recognized the value of small movements, such as fidgeting. Research shows that fidgeting and other non-exercise activities contribute to what is known as non-exercise activity thermogenesis, NEAT, which helps burn additional calories and counteract the effects of prolonged sitting. Studies indicate that individuals who engage in frequent movement throughout the day have a lower risk of heart disease compared to those with sedentary lifestyles. While walking and fidgeting provide benefits, Dr. DeBakey emphasized that they do not entirely replace structured, higher-intensity exercise. He encouraged a combination of moderate activity and occasional vigorous exercise for optimal heart health. 2. Work with passion and stay engaged. For Dr. DeBakey, work was not just a duty but a passion. Rising at 4 a.m. each day, he began his morning with exercise before heading to the hospital. He never retired, working 16-hour days well into his 90s. He believed that meaningful work provided purpose, mental stimulation, and even relaxation. To him, the operating room was more soothing than any vacation spot. Despite acknowledging that excessive stress can be harmful, he viewed a certain level of stress as beneficial, stating that it can bring out the best in people. He embraced new challenges, traveled, mentored, and continuously contributed to medical advancements. One of his last major contributions was co-developing a miniature heart pump with NASA, Dr. George Noon, and Micron Technology Incorporated, which has since saved countless lives. Dr. DeBakey's philosophy was clear. Staying busy, engaged, and curious adds meaning to life, and can significantly contribute to longevity. 3. Manage stress, the silent killer. While Dr. DeBakey thrived on productivity, he recognized the dangers of chronic stress. He warned that many people try to relieve stress with alcohol, not realizing that this approach often worsens the situation. Chronic stress triggers the release of hormones like cortisol and adrenaline, which elevate blood pressure and inflammation, leading to heart disease. Additionally, prolonged stress can lead to unhealthy habits such as overeating, smoking, and physical inactivity, further harming heart health. Dr. DeBakey suggested alternative stress relief methods, including spending time in nature, engaging in hobbies, and laughing. He firmly believed that positive emotions and humor could be powerful medicine against stress. 4. Avoid smoking, a deadly habit. As a young physician, Dr. DeBakey researched lung cancer patients and discovered that nearly all of them were smokers. In 1939, his research helped establish the first documented link between smoking and lung cancer, preceding the U.S. Surgeon General's report by 25 years. Smoking remains the leading cause of lung cancer, responsible for approximately 85% of cases worldwide. Additionally, it significantly increases the risk of heart disease by damaging blood vessels, increasing blood pressure, and raising bad cholesterol levels. Dr. DeBakey strongly advocated against smoking, recognizing it as one of the most preventable causes of heart disease. 5. Follow a heart-healthy diet doctor. DeBakey emphasized the importance of diet in maintaining a healthy heart. His book, The Living Heart Shopper's Guide, provides detailed nutritional information to help people reduce cholesterol intake to under 300 milligrams per day and limit saturated fat to 10% of total calories. Though he did not strictly follow a specific diet, he avoided butter, fatty meats, and fried foods. He preferred baking or steaming food instead of frying and focused on consuming fresh, raw vegetables. He believed that cutting out unhealthy foods could add 5 to 7 years to a person's life. What did Dr. DeBakey eat? In his younger years, Dr. DeBakey's breakfast was simple yet nutritious, consisting of cottage cheese, whole grain porridge, and black tea. These foods provided essential nutrients, fiber, and antioxidants, helping regulate blood sugar and support digestion. For lunch, he often had bean soup or baked fish with raw vegetables. Bean soup is rich in plant-based protein and fiber, while baked fish, especially fatty fish like salmon, provides hard, healthy omega-3 fatty acids. Raw vegetables offer essential vitamins, minerals, and antioxidants to support overall health. Later in life, Dr. DeBakey transitioned to eating just one meal a day, often a large salad. He followed a philosophy of moderation, ensuring that his portions were sufficient but not excessive. A heart-healthy dressing Dr. DeBakey supported simple, nutritious meals and even endorsed a heart-healthy salad dressing developed by Baylor College of Medicine's Sugar, Heart, and Life program. This dressing, made from fat-free yogurt, non-fat mayonnaise, fresh chives, dill, and lemon juice, aligns with his commitment to cardiovascular wellness. Final thoughts. Dr. Michael DeBakey's life is a testament to the power of passion, purpose, and a heart-healthy lifestyle. He proved that with dedication, balance, and the right habits, one can maintain vitality well into old age. His insights on diet, exercise, stress management, and lifelong learning continue to inspire people worldwide. If you found this information valuable, don't forget to like this video and subscribe to the channel for more insights on health and longevity. Stay proactive about your health and take steps today to protect your heart for years to come.